Recently, I've been able to create a voice assistant AI that can be able to listen to the conversation between the doctors and the patient, and it automatically populate all the checklists, including vital signs history, into our app. So it can make the doctor life easier and make the visit faster.
Yeah, we have many funny interactions, but I remember this particular interaction. I was thinking, the people in LA, they need something special. Yeah, I can talk about claims, but they're probably doing well enough. What would be the wow factor in the year 2026? Ambient AI. So the idea is like, I'm a doctor, I say, blah, 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 17-year-old with this diagnosis. I think they have pneumonia. I would like to treat with this. And then you produce a note. And I had to say, when I first saw this, I'm like, this is awesome. But that technology still has the same problem as that unstructured note that Dr. Sylvia talked about. You can't just let the provider say what they want. I mean, you can, but it doesn't address the gaps. And so, although it was cool, I remember you produced the Ambient AI piece in a day. But what made it interesting was to make it agentic AI. In other words, to help the provider make their decisions. So what you did, and I don't know how you did it, and I remember once I asked you to explain how you did it, you know what you said?
What?
I can't explain it to you. Because he basically said I wouldn't understand, which was kind of
too long.
not very nice. No, I don't think it was very nice. It was basically a shot across the bow of my intellect. But I said, whatever way you did it, you were able to, based on what the provider is saying, pick the checklist of the 175 to 200 checklists that we have and pick the checklist that most matched. Have the doctor approve, because we give them options. We don't say you have to diagnose this. We're just saying by your language, this matches asthma. This matches typhoid. This matches uncontrolled diabetes. And then you were able to fill out the checklist elements that they said, but also highlight the medicines that were to be prescribed, but needed a platform like ours to actually send it through the system. Right? You can't just have a note that says, we'll prescribe Tylenol or a paracetamol or metronidazole or propanolol or whatever all, and don't actually have the connection. And so I think that's what was kind of amazing to me. Now, we're still in beta, but it's just one example of the type of features that we are developing always.